Okay, lastly, I want to talk about really serious condition, and it is an infection called infective endocarditis, which can attack one of the heart valves. Point of entry is obviously through the bloodstream. It can be from bacterial or fungal infection, and it's traveling through the bloodstream, and it likes to lodge itself onto a valve. So let's take, for example, this aortic valve. And the aortic valve will look like that. And the aortic valves are held on by these chordae tendineae, which look like parachute strings, and they're held on by papillary muscles. And those papillary muscles hold those parachutes nicely in place to the valve. So what can happen is that with infective endocarditis is that the infection becomes like a vegetation and a growth, and it can start growing on the heart valve, this vegetation. So in ultrasound and diagnostics and an echo, these people will present to the hospital with a history of fever. They will have a murmur when people listen to their heart sounds, and then they will also have possibly this very tiny little peripheral emboli, which are little like blood clots in their fingers or in their peripheries in their feet, which they think is actually from the vegetation that is being dislodged, traveling in the bloodstream, and lands up at the very extreme peripheral smallest point. So these people are extremely sick and need urgent attention, because when this is being left, that vegetation will continue to grow, not only on the leaflet, but will start growing along these chordae tendineae. So urgent need. A cardiothoracic surgeon will go in, and again, they will look at either repairing it or it would need to be replaced. These people will be on extreme IV antibiotics to kill that bacteria and kill that growth, because if any of that remnant bacteria is floating around, even with a brand new valve replacement, is extremely dangerous. So these people will go home to hospital in the home, and they will land up with an aggressive 6-week IV antibiotic therapy to clear any remnant of that bacteria. So again, they present with a history of a fever and feeling extremely unwell, heart murmur, and possibly or they will have little emboli, blood clots in their peripheries. Okay, extremely dangerous and needs to be addressed straight away. Again, I am information only, and for any concerns on that or further information, please see your healthcare provider and seek medical advice. But that's it for now with this course on valves. See you later.